it for yourself, so I always try to kind of keep it at like a hip level when you're kind of doing this. I always look at the size of them to try to get an idea about like, am I going to be able to get around them well. So as he kind of set it up, I've seen different people do it different ways. Again, this is just one of the ways he can do it, but it's my way, so it's the best. Okay. So I always have them kind of cross their arms over here. I always say hug yourself, love yourself. It's really important to make sure that they try to kind of lock these arms around them so that they create a nice rigid unit. Because as I'm doing this, what I always try to picture is if I'm trying to create the force vector that kind of comes from my my xiphoid process region right over here, I want that force to be as quickly dispersed through his body to where my hand is underneath it. And so I don't want that force to be dissipated out. And so if he's not locked over here, that force gets dissipated a little bit. And so we're gonna have to put more force to be able to get the same kind of thing. And so I keep it over there. Big wrestling principle when you're like trying to kind of gain control is you kind of grab above the elbow. So with my cephalad hand, I kind of grab above the elbow and I pull over and down like this right over here. So I keep this area nice and locked up, and then I can kind of have access to his thoracic spine wherever I need to. So if I'm like, okay, let me see here, where's dysfunction? So here's dysfunction right here. I'm gonna go ahead, I'm gonna get my hand, my thenar eminence right on that right over there. I'm gonna take this over here and I rotate it so I kind of tuck this right in, and then it just articulated on me just as I was kind of setting it up here. But if it didn't, okay, so I have pressure right over here. Now, anybody here a wrestler? Okay, so when you try to pin somebody, what do they tell you to do? Huh?
Tee out.
Well, tee out, but what do you do with your head? You try to look down at them?
No.
You try to look up, okay? So that difference in pressure when you're looking down versus looking up makes a big difference. You feel that difference right there? Okay, so again, I'm trying to take my center of mass, I'm trying to transfer it more centrally right here. When I do this right here, it creates a lot more pressure across that area. So you can appreciate that right there, okay? And so then other things, go ahead and lift your head forward for me. If it's neutral, I take it over this way to set it up. If it's non-neutral, I take it over this way to set it up. Okay, just got another thing to I just got a rib to articulate also as I kind of set that there, and then I can do my thrust down to be able to kind of get it there. If it's still, other little tricks I do is the higher up that you go, the more you need to flatten out the thoracic kyphosis. So I can bend up the knees over here to help flatten it out a little bit over here. Now if I'm gonna be in this area of the table right over here, and my hand's gonna be right in this right over here, I either have to have them scoot up, scoot down, or just flip sides of the table to make it easier so my hand doesn't find itself in that groove. So I'm not going to be able to do the articulation as well. So if I want if I want to get thoracic junction, somebody was asking me this earlier here today, what I will do is I'll kind of get right up in the cervical thoracic junction area here. Again, tuck it here, lift your head up right here. Now lift your butt up for me, okay? And it just started articulating, so I didn't even have to thrust on it. And so again, like the fact that I can set it up and I don't even have to thrust, it's just an articulatory kind of thing, that means that it's a lot easier and a lot less force that you have to put through on the patient. One thing I also see a lot of you doing is having them go through several respiratory cycles of breathe in, breathe out before you do that. If you set this up the right way, it's kind of a boa constrictor effect, okay? If I have this locked out and I say breathe in, breathe out, every time he's breathing in or breathing out, I'm like essentially tightening up a little bit more, and when he tries to breathe in, he can't. It's got that constrictor kind of effect. So his body is gonna go into that fight or flight kind of thing. It's gonna start tightening up all the intercostal muscles, paraspinal muscles, so his body's gonna be fighting me. So I usually just do one round of breathe in, breathe out, go for it. So I don't go through several cycles. So I'll get it set up, okay, breath out, go. Okay, and so I'll just be done with it. So just little ways to kind of refine it there. Now again, if you are not able to kind of get it and it's on a bigger individual and you need some extra force, well, let's show the Kamikaze Crunch over here. So, yeah. So, I don't think I can walk my feet up there, but who knows?
Oh yeah,
Oh, yeah, that might be easier.
On the stage, yeah, we can move it. Yeah, we're fine right here. I don't know what this is. All right. And granted, there's one. I'm going to move this backpack so I'm not tripping on this. You can carry it over here. Okay. So if I got them set up over here. Okay, so I have everything set up as I would. And then I'm like, okay, man, just won't go. Just need a little bit of extra force. So I just walk myself up. Get that off over here. Okay, so I have myself essentially just kind of inverted right over here, and 1 or 2 legs, so I have it right over here. A lot of pressure on you here, and breath in and out, and then I can just kind of thrust down, just like that right there. Okay, so again, just another little MacGyver technique that you can kind of pull out of your butt, and you might be able to kind of get that difficult one that's just not going otherwise. I did this technique on, it became a big hit with our Olympic team. I did it on the coach in our training room, and then at the event right before, one of our guys went out for his bronze medal match. In his semifinal match, he got thrown down. He had some luxed, he had like a really bad posterior rib. I mean, to the point that I actually thought he tore his rhomboid major. He was just so uncomfortable, and we had to get all sorts of weird permissions to be able to even try a trigger point injection. And I was like, and he was like, Doc, anything else he can try? Because we had our massage therapist working on him, we were theragunning him, we were trying all sorts of stuff. And I was like, you know, it feels like a rib underneath there, but the muscle's just so tight. And I was like, let me try, and I actually got the rib to kind of go back in. It's like, oh my God, I can breathe, I can move. And you know, he had trouble even just raising his arm out there, and then he won the bronze medal. And I go, I get partial credit for that. I get to like stand like with my leg out on the podium for you. So, all right, so just if you want to kind of work on that as our last kind of thing, just to